And I'll put myself on mute as well.
Well, good morning, good afternoon, good evening to everybody, and welcome to this next session where we have a terrific set of 4 people talking about different aspects of public involvement in evidence synthesis. So welcome to the session. Let me introduce myself first of all. My name's Jane Lewis. I'm one of the managing directors at the Centre for Evidence and Implementation. We're a global evidence intermediary using evidence synthesis as well as other evidence-based methods to inform practice development and policy development. And it's my great pleasure to be chairing this session. Thank you very much indeed for choosing to spend the next hour with us. We've got 4 speakers, and I'll introduce them each in turn immediately before they give their talk. Please do use the question channel to put your questions forward, whether it's questions for individual speakers or for all 4 of them once the 4 of them are finished presenting, and we'll put those questions to them and ensure that we have a good lively chat. So thank you very much indeed. I'd like to start then by introducing our first speaker, who is Katy Sutcliffe. Katy's an associate professor at the EPPI-Centre, which is part of the UCL Social Research Institute and an absolutely major global driver of evidence synthesis methods that I'm sure lots of us know. Katy's been working in the field of evidence synthesis for 20 years, and she specialises in developing systematic review methods for producing policy relevant evidence, and particularly in thinking about how to involve qualitative and mixed methods evidence synthesis. And Katy is going to talk about recent work that she's been involved in, looking across a number of health-focused systematic reviews and documenting and categorising the methods that are involved. So I'll hand over to Katy. Thank you very much. Katy will share her slides and take it away, Katy.
Thank you, Jane. I'll just try and get my slides up. No. I had it there, ready to go, and now
it's almost the way. Don't worry, stick with it. We'll get there. Katy will talk for just 5 minutes or so, and I'll put probably 1 or 2 questions to her. So do dig into the chat with your questions, and then we'll move on to the next speaker.
My slides were, I really can't find them now. So I don't know if you're able to share them for me. I don't know what's happened. I can see them here on my computer, but I can't see them in the list of windows to share.
That's so frustrating, isn't it? Because it worked absolutely perfectly when you tested them a moment ago. Carrie, are you able to share the slides for Katy?
Let's try that again. Window. It's not there.
Carrie, are you with us still? Are you able to share the slides for Katy? Katy's struggling to get her slides to show, despite the share screen function having worked perfectly a moment ago.
Okay.
Hang on in there, folks. We'll be there in just a moment.
I did warn you that I just have the kiss of death when it comes to technology.
This is everybody's opportunity to shift their minds from whatever you were listening to just now into this lovely topic of public involvement in evidence synthesis. There we are. There you go, Katy.
Excellent. Thank you, Jane. Thank you, Carrie. So thank you very much for waiting. I'm Katy Sutcliffe, and I'm presenting this in progress work on behalf of my colleagues, Rebecca Rees, Gillian Stokes, and Ginny Brunton. So just thinking about the aims of this work, there's rightly been a push to increase the focus of patient and public involvement, or PPI, in systematic reviews. But Matter and Speed, in their 2017 critical reflections on PPI in health research, note that it's a complex field of activity. And there are absolutely lots of examples of excellent practice But with this work, we wanted to compare different approaches to PPI that we've used and to kind of reflect critically on them. And in terms of the method, we purposefully selected 4 health-focused systematic reviews that we'd conducted that had used diverse approaches to PPI. And we used the active framework developed by Alex Pollock and colleagues and published in 2019 to characterise the diversity of PPI according to who the stakeholders were and how they were recruited, the mode of involvement, so is that one-off involvement or a continuous involvement throughout a review, the stage of involvement, so from question setting at the beginning, end of the review through to the interpretation part of the work, and the level of involvement, which the active framework sets out as a spectrum from control through influence to contributing to the review. So if we could have the next slide, please. So this slide is focusing on the nature of these 4 reviews and the PPI participants for each review. So the reviews were conducted between 2004 and 2019, so it's quite a broad period of time. And the first review, the MSM review, focused on HIV health promotion interventions for men who have sex with men. The Hep C review examined evidence on key health conditions associated with chronic hepatitis C, including depression, anxiety, pain, and quality of life. The Lyme review examined patient, clinician, and researcher experiences of treatments for Lyme disease. And the Adverse Childhood Experiences, or ACEs review, involved an overview of reviews on interventions and a qualitative evidence synthesis to answer the question, what helps to support people affected by ACEs? And in terms of who participated, as you can see, the types of patient and public stakeholders varied. So for 3 reviews, we engaged with representatives from existing patient advocacy groups, but the number of groups we engaged with varied across the different reviews. So with the MSM review, it was 2 groups. In the Hep C review, it was 4. And in the Lyme review, we engaged with 8 different groups. But the participants from those groups also had lived experience of the conditions under study. But for the ACEs review, we used a very different approach. We recruited young people directly. So these young people were not part of an existing group. So the next slide, please. So this slide draws out some of the implications of the diversity in these different types of public stakeholders. In terms of prior experience, as the table illustrates, the table's level of experience of being involved in research varied, which had implications for the issues of power balance, the level of support we needed to offer, and the amount of planning and preparation we needed to do to support effective engagement. So the MSM stakeholder group was really a very well-established group that had a strong history of engaging with researchers, and so the support that they needed to contribute was quite minimal. And uniquely for this review, the public stakeholders were involved as part of a broader advisory group with policy and practice stakeholders as well. With the Lyme and Hep C reviews, we had to engage more groups because there were strong differences of opinion across the different groups in terms of how and what they were campaigning for. And these differences of opinion in the case of Lyme disease and hepatitis C were so strong that we had to engage with each group separately. And that precluded the possibility of involving them with policy and practice stakeholders like in the MSM review. Also, the variation across groups in each review with regards to their size. So within the Lyme and Hep C reviews, there was variation in terms of the size, longevity, and experience of engaging with researchers. And that meant that careful and sensitive work was needed to support equitable engagement across the different groups. And for the ACEs public stakeholders, this was the first time for engaging with many, for most or even all of the participants. So we had to do some really careful work and have a really well-planned approach to support their engagement on this sensitive topic. And we were supported by Luca May Brady, who provided expertise engaging with young people. So you can also see that these different types of stakeholders there was diversity in terms of the contribution that they could make and the motivation for joining, with strengths and limitations for each type of stakeholder. So in short, the diversity in the types of patients and publics involved in our reviews impacted both on the process and the outcomes of PPI. Next slide, please.
If you could just move to finish in the next half a minute or so, Katy.
Yeah, sure. So this slide examines how the participants were involved rather than who was involved, and clearly there was diversity in terms of the stage that stakeholders were involved, and that this relates to the level of involvement as set out in the active framework. And then to go to the next slide, please. We reflected on the diversity in terms of the stage and level of involvement, and judged it was related to the purpose of the PPI, which was in turn related to the purpose of the review itself, with the HEPC being a review for a very instrumental or practical purpose to design an appeal or compensation process, whereas the other reviews, policymakers were more interested in the general areas, and these reviews are more commissioned to provide enlightenment. And then if we go to my final slide. So the variation in who, how, and what really was in response to the context and purpose of each review. The active framework that we used to characterize them was enormously helpful, but in using it, we identified some issues. For example, our work illustrates that variation in terms of the nature of public stakeholders is an important dimension of difference, whereas the active framework just distinguishes between public and patient stakeholders and other, so policy and practice stakeholders. And our final reflections on guidance for PPI is because it needs to respond to the unique context of a review. In general, we feel it's important to avoid being overly prescriptive about who, when, what, and how it should be done, and avoid implying that more is always better. And finally, we kind of began to understand that the potential for PPI varies systematically depending on the context of the review. The purpose of the review should drive thoughtful and appropriate PPI plans, and that reviewers need to report not only what is done and how, but also why and the impact of the PPI on the review. Thank you.
That is absolutely brilliant, Katy. I can't believe how much really juicy, detailed information you got across in no time at all. Thank you very much indeed. Just one quick question. What do you see as the particular strengths of the active framework?
It was born out of looking at a very high level at the different diversity of stakeholder engagement, and I think it was really valuable in drawing out the different dimensions that we might consider when doing it. It was a really good starting point for us, but I think it's looking at a very high level, and then when we were coming to look at much more detail, I think that's where we were there was some challenges and some additional things that we were seeing by taking this closer look.
It's terrific. I mean, a really lovely example of the importance of drilling down and looking thoughtfully and in detail and in a very purposeful way at the way that we're going about doing systematic reviews. Katy, thank you very much. Just switch your camera off now, and we'll bring you back in for the panel discussion. Thank you. And some really lovely positive comments coming through in the chat as well. Okay, we're going to move on now to Pastan Yusiba. Pastan is a research scientist at the Centre for Rapid Evidence Synthesis, ACRES, which is part of Makerere University in South Africa. He has extensive research experience in qualitative and quantitative approaches, and a lot of experience across evidence synthesis, particularly in providing timely evidence in response to policymakers' requests in decision and policy-making processes through the Rapid Response Service. He's also very involved in health systems research and research to improve the whole spectrum of evidence synthesis. And he's going to give, at speed and in only 5 minutes, a really interesting paper on some innovative methods that he and colleagues have been using in evidence synthesis. So Pastan, over to you. Are you going to share your slides, or is Carrie going to share them for you?
Unfortunately, my share screen button is not working, and I think I'm sending my slides to the wrong email. I've shared, I think, about 3 times
Ah, okay.
to Carrie.
Right.
Yeah,
Carrie,
they
have you
haven't.
received?
I haven't at my end. They're not coming through for some reason.
Okay. I mean, Paston, are you able to give your talk without using slides? Or should we move
Sure.
on to another speaker and give you an opportunity to try to get your slides to Carrie?
Yeah, I think we could explore the option of pushing my presentation for a few minutes, and we see if we can solve this.
That's fine. Let's do that, and let's see if Carrie's able to get them. So let's move on instead to the next presentation, which is Alison O'Mara-Eves, who is going to. No, it isn't. It's Karen Schucan Bird. Sorry, Karen. So Karen, welcome. Karen is Associate Professor of Social and Political Science at the Social Research Institute at UCL and part of the EPPI-Centre, as Katy is. And Karen there has completed systematic maps and evidence syntheses in a range of fields, particularly focused on domestic abuse. And she is going to be talking this afternoon about ethics in systematic review methods. So Karen, over to you if you're able to share your presentation.
Is that working?
Not yet. Gosh, it's so frustrating. Ah, here we go. Here you go. There you are.
Okay, okay, we're on, and you can hear me fine. That's fantastic. Okay, thank you, Jane. I'd first like to thank and acknowledge my co-authors, so Nicola Stokes and Martha Tomlinson from the Safe Lives, and Professor Carol Revis from the EPPI-Centre. So, like Jane said, I'm here to talk about the ethics. I'm sorry, I'm just going to try and work out how to move that along. Has that moved along? Yes, okay. The ethics around systematic review, and this is exploring some of the debates around the ethics of undertaking collaborative systematic reviews. And this is based on a recently completed systematic review that I've led in the field of domestic abuse. And this is pertinent for thinking about ethical issues in the processes of systematic reviews for a number of reasons. Firstly, there's a lot of rich scholarly debate around ethics and research in the field of domestic abuse, and I think we can learn lessons from them to translate into our work. And secondly, this case study, this review was very collaborative in nature. It was a collaboration between academics in a university and researchers in a domestic abuse charity. It also involved an advisory group, which involved a number of different experts, including individuals with lived experience. So that's speaking to perhaps the public engagement element of this panel. So to examine the ethical implications associated with this review, we used an ethical framework called the Research Integrity Framework that was published by the Women's Aid, which is a domestic abuse charity in the UK. And this framework attempts to sketch out what good research practice relating to domestic violence and abuse looks like. And it uses five pillars to set out the ethical priorities for undertaking ethical research in the field of domestic abuse. And I'm going to use these 5 pillars to quickly advance a few ethical priorities that we should consider as reviewers in collaborative systematic reviews. So I begin with the first pillar, which focuses on the safety and well-being of all individuals that are involved in the systematic review process. And first up, I want to make the point that in the domestic abuse sector, in terms of the research and work they carry out there, they have strategies to ensure the well-being of the researchers and every member of the stakeholder group that's involved in the project. And I feel in academia, those strategies aren't necessarily as well embedded in the work we do. So I think there's scope there to further the strategies that we're using to ensure the well-being and safety of systematic reviewers when working on topics that are difficult and challenging, such as domestic abuse. Secondly, the sector also ensures that the physical and emotional safety of advisory group members is at the utmost importance. So here we're talking about ensuring that if we're holding meetings online, that the physical and privacy of those contributors are maintained, and you're seeking assurances that their physical and emotional well-being is assured in the research processes and enabling them to contribute safely. The second pillar focuses on transparency and accountability in research. And we all know that in systematic reviews, transparency is a key defining element of our work. And so I think on the whole, systematic reviews do adhere to this pillar. But within this case study, we identified just a couple of areas that we thought we could strengthen our kind of ethical approach in this respect. Firstly, we've had discussions about how to recognise the contributions of all members of the team, including the advisory group, on the outputs, and try to have a discussion about how we order and recognise the different contributions that we've made. Secondly, the point I want to make here is about the need to balance transparency with accessible messaging when we're trying to communicate with non-academic audiences and reaching out to lay people. I think it's sometimes different to communicate the complexity in a transparent way, but also maintain accessible understanding and messaging. So the third pillar that the research integrity framework speaks to is this idea of equality, human rights and social justice. And so we know there's a growing recognition in the systematic reviews that they can help to explore and advance issues related to equality and social justice. And this review very much fitted within that tradition as it endeavoured to improve the outcomes for victims and survivors of abuse. And therefore, in this regard, it kind of seemed to try to uphold these kind of ethical approaches to research. However, we identified a couple of areas that I'd like to propose here where we could really strengthen our approach. The first one is referring to systematic reviewer reflexivity and seeking to embed our reflexivity and reflect on our positionality in the conduct and reporting procedures of systematic reviews. The second point speaks to representing diverse perspectives in the review process throughout the whole review process in the team and the advisory group. And this perhaps builds a little bit on what Katy was talking about earlier. The fourth pillar focuses very much on engagement, and obviously that's what the whole panel is focused on today, thinking about the collaborative nature of systematic reviews and the way in which we tend to seek to involve a wide range of different users in our work. So whilst this is inherently positive and meets the ethical criteria that we have they've stipulated in this framework, I think there's also a couple of points that I wanted to raise that potentially challenges in this field as well. So firstly, the case study wanted to recognise that there is challenges around potential conflicts of interest. So working with non-academic stakeholders, potentially of charities who have a vested interest in the outcome of the research. This is something that needs to be considered and reflected on in the whole process of undertaking that research. The second point is around the distribution of power across different stakeholders and reviewers in the review process. So we also reflected on the way in which within our case study review, the power was distributed across different individuals and groups to ensure there was this kind of overall balance, when typically the money and funding and direction of the work often lies with the academic institution.
Karen, if you could move to a close, that would be very helpful. Thank you.
Okay, brilliant, thank you. So I will quickly mention pillar 5 and then I'll round up then. So the research ethics point here is to recognise the value and potential of the research ethics committees that obviously sit within our institutions and academic institutions and structures to review the ethical dimensions of our research, but these are often not very useful for systematic reviews and often don't recognise some of the challenges around systematic reviewing or in the field of domestic abuse. And I think there's room there to improve those procedures to meet that need. So thank you very much for listening. If you'd like to find out more, I've got my protocol published for this review, and we've got a journal article forthcoming that kind of outlines in a bit more detail these issues that I've raised here. Thank you.
That's brilliant, Karen. Thank you so much. It's such an important issue, and one that I think particularly when people start thinking about how to involve people with lived experience in systematic reviewing, they really find very, very challenging. And you've given some incredibly helpful guidance there and a really useful looking framework. I'm going to suggest that we move on to Pastan's talk now, because I think the question of ethics in systematic reviewing is one that all of the panel will have really helpful perspectives on. So Karen, thank you very much. Thank you very much indeed. We've managed to get Pastan's presentation together, and so Pastan, if you're ready to go, then I'll hand over to you. I've introduced you already and explained that you'll be talking about an innovative approach to evidence synthesis, and I'll just hand straight over to you for your 5 minutes. Thanks, Pastan.
All right, thank you, Jane. Carrie, could you put up the slides, please? Thank you. And as Carrie puts up the slides, Jane, I'm from Uganda, not South Africa. I just thought I'd throw that out there.
Gosh, I'm so sorry. That is a terrible error on my part. I'm really sorry, Pastan. Thank you.
Thank you. So I'm talking about ongoing work we are doing at ACAS. And we are trying to standardize methods for use of social media data for research and EIDM approaches in low and middle income countries. So in terms of understanding where we are coming from in doing this, COVID-19 pandemic presented challenging times for research. Next slide, please. Sorry. It presented really challenging times for research and EIDM approaches. So, because there were movement and close contact restrictions for extended periods of time. Yet during those times, there were really urgent decisions and policies that were being we couldn't really get citizen voices into these policy processes. So our conventional approach here at ACAS is we compile evidence from sources from online and literature, and we combine it in a sort of a rapid response brief, and we provide it to policymakers. And we supplement this with citizen voices. We get these voices through an approach called citizen panels and policy dialogues. But we could not do this because of the movement restrictions. But by then, social media, people were really discussing these issues, and they were out there in the public domain, and people were discussing these issues. But we missed out that opportunity to get this information from social media, compile it, and put it out there to the policymakers to help in the decision and policy making processes. So from that, we'll find ways of how we can get this information from social media and put it in policy processes while meeting ethical and quality standards. Next slide, please. So we designed a study that has quite a number of objectives, including designing of tools to extract, analyze, and report results from social media websites, determine the extent to which these results from analysis performed from social media data conform to the results from conventional research and EIDM approaches, including citizen panels, establish and compare costs of using social media versus the established approaches. And the focus of today, identifying gaps in ethical regulation of social media research and establishing how to regulate it to meet ethical standards, and determine acceptability of social media evidence products among academicians and policy makers within low and middle income countries. So for this forum, we are going to look at the identified gaps in ethical regulation of social media research. And just to mention, we are at desk review stage, and the results of this stage are guiding us in implementing and designing our next stage of this project. Next slide, please. So majorly, there's quite a lot of information, but we can say that there are majorly 4 groups of these ethical issues we've identified. And there is privacy, anonymity and confidentiality, authenticity of the information and the social media users, and the rapidly changing global environment. Those are the overarching issues we've identified. So I'll start with privacy. There are concerns about the privacy of users' data. Some of it all depends on the privacy settings of a social media website. Facebook have purposefully eroded the concept of privacy by claiming that users want to share all the information they put out there. People, we can debate about that, but there are still questions about whether really people are comfortable about us using their data for whatever purposes we want. Yeah, and if this is not possible, still we ask ourselves questions about if it is feasible to obtain informed consent from all these users whose data is going, we are trying to use for our research and EID. So that is something we are looking at seriously, and we are going to look at it rigorously in our next phase of this project. Then anonymity and confidentiality. Social media content is really highly traceable, and so confidentiality and anonymity might not always be possible for such content. For research and other knowledge translation approaches that need to quote the user's content in their write-up, it is very easy for someone to pick that quote and search it in Google and locate the source of that information. And in places where people are prosecuted, or persecuted, if you may, for what they share on social media, we have to establish concrete ways of how such people have to be protected from authorities who consume the products of analysis of social media data. This is something we are going to pursue seriously and find a solution to. Then authenticity of users. There are a lot of anonymous and fake user accounts and bots on different social media platforms. So ensuring authenticity of data coming from such users is a bit problematic, and this ultimately affects the quality of the data we have. Some sources have suggested that using authentication tools to sieve out such users and ultimately their data could be helpful. But on the other side, some users say that what we need is the information, not the people sharing it. So if a person is anonymous, they tend to share like what is really on their mind than someone who uses their really identity. So that is something we are going to pursue and ensure that we find a solution to.
Hassan, this is really fascinating. Could I ask you just to move to a close, and then we'll come back and ask you more?
Yes, this is the closing statement. The rapidly changing global environment, social media are rapidly changing in terms of how people use it, how they engage with the platforms, the social and cultural norms, the terms and conditions for use, governance, regulation, and legislation. So we need to be cognizant of this, and we have to ensure that we are on the right side of especially the law if we are in jurisdictions where social media is something they are moving to crack down on. Next slide. All right, thank you. That's all I had to share.
That's absolutely brilliant. Pastan, thank you very much indeed. That's really, really interesting. I mean, there is so much more potential, isn't there, for the use of social media? Pastan, could you just sort of say a little bit about your experience of using social media to inform systematic reviews in particular? Is that an area that you and colleagues have worked on? I'd be fascinated to hear more about how you've used social media to shape systematic reviews or to inform your approach to systematic reviews.
We have not actually. That's why we are trying to find these methods and standardize them to ensure that when you put something out there, it can be held in high regard as of quality and ethical. So we are starting here to get these methods, and then we can move into putting products out there using social media data.
Well, that's great, and that's perhaps something that, as a panel, we might, if we have time, we might ask you all to reflect on. Pastan, thank you very much indeed. That was really, really interesting. Thank you. We'll just move on then and introduce our last two speakers and the last talk. So this is Alison O'Mara-Eves and her colleague Angela Chesworth. Alison's an associate professor, again at the EPPI-Centre. I said that they were the EPPI-Centre of systematic reviews, and so they are, at the UCL Social Research Institute. Alison conducted her first systematic review nearly 20 years ago, and since then she's worked on dozens of different reviews and on a number of projects for developing systematic review methods. And she's recently been working on 3 projects with a co-production element, and I'm sure this is a sentiment shared by everybody here, sees that as a really important element of the next generation of systematic reviewing. And she's joined by her colleague Angela Chesworth, who is a lived experience colleague who's been working with Alison in the co-production study. So I'll hand over to both of you. And Alison, do share your screen. Thank you both very much indeed.
Let's see how quickly I can get this up. Is that showing now? Hopefully. I'd like to acknowledge my co-authors and colleagues on this project. So Dylan, Sandy, Lizzie, Nicola, Jessica, Angela, who's joined us here today, Bridget, Katie, who we heard from earlier in this session, and James. Just to give a little bit of background to where we've come from with this particular project, it's part of a broader project called the CEFI project, which was about developing and testing 4 different methods for synthesizing evidence that better accounts for context than standard statistical meta-analysis approaches. So we're trying to find new ways to look at how evidence that's conducted in different settings or global average summaries that you get in a statistical meta-analysis, how they might apply to specific local contexts. And when we're thinking about how should we go about doing this, we identified that co-production could be a really important approach to understand actually what is important in different contexts. It's not for us to say what matters in different areas. We need to speak to people and find out what we should be looking at. So we incorporated co-production into the project, and it came across the different research elements in different ways. So for the theory development, we developed a logic model entirely through co-production. So it was very much driven by and worked together with our co-production team. And then we had a methods development element where we're looking at statistical approaches and so on. That aspect wasn't co-produced as such, but it was heavily informed by the theory and responses of our co-producers. And the whole project was overseen by or working with an advisory group. And in that advisory group, we had co-producers that were invited because of their lived experience and expertise, their professional expertise, and or their academic expertise. So we had a very wide range of people from policy, practice, patient, and so on. A lot of variety, trying to get different views on what's important for the project. The listening was incorporated from the outset. So we had invitations that we sent out to our advisory group actually helped identify the setting of interest. We were initially thinking broader, and we narrowed down to school-based interventions because of the response that we got from our advisory group. So from the whole starting concept of the project, we were responding to and listening to what different members of the group were saying. We also had workshops. So I mentioned that the logic model, the theory development, was entirely co-produced. This was all done because it was during the pandemic. It was all done online through workshops. And again, the co-producers were invited because of their lived expertise, whether it be direct or indirect with the particular health topic that we were working on. But we also had people with professional expertise, which in this case included teachers, GPs, occupational therapists, and public health practitioners. And or people with academic expertise. So in most cases, people sort of had multiple roles, I suppose, or multiple ways in which they contributed. There wasn't just boxing of people. Everyone kind of moved in and around different roles to help work together on the logic model. And then we had an evaluation element where we took some reflexive notes, there was feedback from participants, and there was also extensive discussions that were documented during and after the project to help us see in which ways the co-production had contributed to the development of the work. Now I'm going to hand over to Angela to say what, from Angela's perspective, what it was like to do co-production as a public contributor.
Hello, thank you, Alison. For me, as an obesity patient advocate with no medical or academic experience, I found the co-production extremely valuable. I was welcomed as Angela, and I was empowered to share my lived experience in a safe space without judgment. My opinion was valued, which led me to be comfortable to have my patient's voice heard. I learned so much from the other co-authors, which I will carry forward. The group treated everybody with dignity and respect, which was hugely important. And it allowed us all to come together as one, to see things from different perspectives, which was hugely of value to achieving the goals of the task. That it was invaluable to have the patient's voice there for me to learn about the perspectives of the academics and other sectors of the task. We all need to have an understanding of what the experiences, the barriers and the challenges that everyone faces. Thank you, Alison.
Thanks, Angela. So you can see the experience was very much echoed by all of us, that we felt there was a trust and relationships were built, and we all learned a lot from each other, and from the project took on a life of its own. It was a hugely influential experience, I think, for all of us. But the impact of engaging contributors in terms of the project itself was huge. We entirely reframed the whole problem that we were focusing on, from narrow biomedical studies to the broader socio-political ecosystem. Now, so far, I've kind of avoided talking about the topic focus, because this presentation is more about how we worked together and what that meant for us. But to give a bit of context, we were originally starting out looking at childhood weight and overweight and obesity. And initially, the problem, as it's framed in much of the academic literature, focuses very much on BMI as an outcome. And the experience through the co-production, it shifted completely. BMI just got ditched pretty much from day one to focus on other aspects of healthy lifestyle and well-being. So the logic model we produce is very different. BMI doesn't factor into it. We narrowed, as I mentioned at the start, we narrowed our context to school-based interventions. Initially, we didn't have a particular setting in mind, but we had this resounding response from teachers when we were trying to recruit, where teachers were saying they wanted to make a contribution to understanding healthy weight and healthy lifestyles for children. And we co-produced the theory to guide these later stages of synthesis methods development, and it really framed the analyses. It changed what we did in our analytical approaches. It also allowed us to critique and understand the body of evidence using a new frame of reference. Like when we looked at these academic papers that a few weeks beforehand, we would have had a very different perspective. We saw different things and pulled different types of information out. It just really, all of us had quite a transformational experience, you may be gathering. And through it all, there was this emotional impact as well. There were some real joys, some real like coming together moments where it was like, wow, look what we're discovering and learning and sharing with each other. There were a few discomfort moments as well, if I'm honest. There were times when it's, this is new territory and you weren't always sure how to react or respond to things, but it's all part of the journey, and it was, it was fantastic. So in terms of just closing up, co-production is a powerful way to develop logic models and to inform synthesis methods development by focusing on what is important to the affected communities. It really helps you hone in on the key issues. Some of the lessons that we learned was that involving communities allows prioritizing insights of communities over the availability of data. If you just looked at what's available, you would focus very much on BMI because that's all the main dominant sort of outcome being measured in these areas. But looking at what everyone was saying was important, it shifted focus hugely. So it's prioritizing what's important to people rather than what's available. We discovered through the work that training and co-production can help clarify understanding and help you have some tools to approach certain situations and things. But some of the skills for doing co-production actually may be a bit more tacit or something, and maybe perhaps come through life experience of observing people and interacting in social situations. So it's difficult to know how much of it can be taught as opposed to just being learnt through experience. What would we do differently next time? We'd allow a bit more space for emotional reactions, healing and re-engagement. We did have a situation where someone got uncomfortable with what was happening and wanted to disengage briefly, and it was a bit of a challenge. So we were still learning how to have this re-engagement and healing process. We consider bringing co-producers from the advisory group to other co-production events so that they could see the bigger picture of the project. We slightly compartmentalized the advisory group separately from the co-production group in the workshops. And in hindsight, maybe that didn't need to happen. There could have been more interaction between the two groups more. And we definitely involve the co-producers more in interpretation and write-up. Some of the facilitators for meaningful co-production, we felt
just really quickly, if you could, Alison, thank you.
Oh yeah, this is the last point. Repeated involvement to allow thinking time and debate as ideas developed, and interactive technology. So we use sticky notes and electronic whiteboards. So Miro board was really helpful for us, allowed us to think in real time and people contribute simultaneously. So it was a good tool to use. That's it.
That's brilliant. Thank you both so much, Angela and Alison. That was a really vivid illustration of the importance of co-production and some really, really terrific, tangible differences that you felt it made to the project. Thank you both very much indeed. If everybody could put their cameras back on, then let's move to some more open discussion, because I wanted to start off by asking about the ethics of some of the ethical issues in systematic reviewing, because I feel like that's been a kind of feature throughout all four talks. And there's a really good question about this from Kira Keenan. Kira, we can't put you on mic, I'm afraid, but I'll read your question out, which is how we can best encourage reviewers to be especially cautious of how we make our recommendations to policy and practice. controversial debates in our discursive sections of reports? Would it be through the work you're doing? This question was directed particularly to Karen. Would it be through the work you're doing, leading by example, or by getting review collaborations like EPPI, Campbell, Cochrane, etc., to provide more robust advice in their guidelines, or changing expectations? I mean, what are people's thoughts about how we can best handle the ethics of the way in which systematic reviews are discussed and how they engage with these controversial debates? Karen, should we start with you, since the question was directed to you, and then come on to others?
Yeah, thank you. Thanks for that question. Yeah, I think that's really important. When I've started thinking about the overlap between ethics and systematic reviews and domestic violence, I was quite surprised at how little scholarly work there is out there that addresses this, and the lack of methodological guidance. So if you look at the Cochrane Handbook or any of these kind of tools that we use to guide our methods, there's a real lack of kind of discussion about ethics. So I definitely think there's a role for some organisations to take a lead in this thinking. But then, as you can see from the work we're doing, or we've presented today across the panel, we're already kind of like addressing a lot of the issues, but maybe they're just not all coming together in the same place. Or it's kind of sporadically addressed across the work we're doing. So yeah, I think it's very hopeful and positive.
Excellent. Anyone else on the panel want to come in on this question or any other aspect of ethics in systematic reviews? Fire away, Alison.
I would recommend, if we, I think this is an important thing for us to be taking forward as systematic reviewers, and I'd recommend co-production of working out what some ethical guidelines could be, because a different project that I was working on recently, where we did a systematic review of co-production in research, the co-production members with the lived experience that we was talking to actually found it offensive when studies wanted to do ethics approval for co-production members, when it wasn't equally applied to the academic members of the team, because all of a sudden you're supposed to be doing something together, but some people seem like they need safeguarding or protecting by getting the ethical approval, whereas the academics were seen as, we can handle ourselves, we don't need ethical approval. So their view was very much that either everyone has to be under ethical approval mechanisms, or no one on the co-production team should be. But basically, there should be, if it's equal power, then equal ethical consideration. And so I think there'd be quite a lot of interesting things that we might not consider like that if we speak to our different people with different types of expertise. Yeah.
That's such an important point, taking an understanding the ethical perspective of people who are involved in projects, rather than feeling that researchers can speak on their behalf or identify ethical issues on their behalf. That's really helpful. Thank you. Paston, was there anything that you wanted to add, having drilled down a lot into the ethics of social media involvement? I don't mean to put you on the spot, just to give you an opportunity to come in if you'd like to. Okay. I don't know if you can hear me, Paston.
Sorry, I didn't get you there. Sorry.
I'm sorry, Paston. I was just asking whether there were any comments that you wanted to make on the ethics of social media, involving social media, or any other aspects of ethics in systematic reviews, as that's an area that you've looked at in some detail. I mean, from your perspective, what are the most important ethical considerations in public involvement in systematic reviews?
All right, thank you, Jenny. Just to re-echo, I think it would be about the way how we identify the sources of information that we use in our research. and how to sieve out information that is from more automated users than users who are like real, if I may say. It's something we have to really look out for, because we have seen it, especially if I'm to use the case of Uganda, there are really multiple accounts which are run by a single person, especially the security operatives, and they are used to comment about different things, about different topical issues going on within the country. So it is very important to sieve out such information and make sure that the information we're getting is from real people, not just bots or accounts controlled by the state to drive discussions in a certain direction. Thank you.
Yeah, that's really helpful, Pascal. Thank you. Thank you. I wanted to come back to an issue that Katy, you raised in your talk, where you really nicely drilled down into the different kind of stages and levels of public involvement in different systematic reviews. And if I'm remembering right, you said something like more is not always better, or more is not necessarily better. And then that sort of contrasted for me a little bit with Alison and Angela's talk, where you described, really rich co-production starting right from the beginning. So, I mean, what are people's thoughts about, are there places where you have seen public involvement done in a light touch way or in a kind of less way, but highly effectively? Or is the panel's view that actually more is more on the whole? What are people's thoughts on that? Katy, do you want to come in first?
Sure, thank you. So, yeah, I think sort of where I was coming from is, I've been involved in this really powerful co-production approach and work that has been, hugely beneficial and had huge impacts on those projects. But then we've done other reviews in other contexts, where, for example, in the Lyme disease work, we were doing a suite of reviews on a range of different things. And we were also doing that work alongside work that NICE was doing. So a lot of different questions were being asked of the research. And so including people's experiences. So some of the work was qualitative evidence synthesis and similar type work that we were looking to draw on evidence of people's experiences. So it felt like it made sense to involve the public stakeholders in a sort of the interpretation of that. We already knew we were asking a question of what are the views and experiences or in this field of their experiences of treatment for Lyme disease, for example, and so we were already seeking that diversity of opinion on the patient experience, but what we wanted was some kind of support in translating that. So, I imagine that there could have been more to have been gained from doing, co-production or involving stakeholders earlier around the kind of questions we were asking, but it was quite a broad question about patient experiences already. So,
yeah, that's really helpful. And I think, the point that you made very powerfully was that you have to start with thinking about what is the purpose and develop the approach based on that. Just in the last minute or so, is there anything that anyone else on the panel wanted to say to this question of whether more is more? Angela, fire away.
Hello. Yeah, I just think from a patient's perspective and my experiences of engaging as an advocate, I think that there's no right or wrong answer, and any communication that can bring us all together to learn from each other is going to be valuable. I understand it's very difficult because as a lived experience, you can open a whole can of worms for the academic side of things because they're looking for an answer to one question, but you give them the answer, but you also give them 10 more questions. So that can be the challenges. But I think it all comes down to communication and the being kind, and just remembering with the ethics side of things is to see everybody as an individual person and not to assume anything, be open and honest in a safe space. And that's the value in coming together.
There's a wonderful flurry of icons, heart signs and claps coming up the screen, Angela, as you're talking. I think what you've said has just really, really landed for people, and it comes back to what Alison was saying about the importance of working through discomfort together sometimes. Folks, that has been such a terrific session. Thank you very much indeed to Karen, Katy, Angela, Pastan, Alison, and just finally, and thank you to everybody for joining, and finally a big plug for Robin Milden's session, which comes up after the break and will be terrific. Thanks, everybody.
Thanks, Jane.
Thank you, Jane. That all went
good. Are we off?
Yes, we're off. Yeah.
Great.
Yeah,
Thank you so much for your help with that, Kerry.
I'm not sure. Thank you.